Thank you. Go ahead and call this meeting to order. Do we have anybody online?
Mayor England's here.
Thank you.
You bet.
Maggie Mann is on, Commissioner.
Thanks, Maggie.
Yep.
Well, we'll go ahead and let you start it off, if you would, Maggie.
Sure, Commissioner Moser. So we are pretty busy right now from a number of perspectives. Our case counts are up. They're pretty high. They're kind of bouncing around between about 1,100 and 1,200 plus active cases right now. So that's the highest active case count we've seen. We're also very busy with vaccinations and guidance. We just got guidance this morning from the Idaho Immunization Program on how to move forward with booster shots. So booster shots are going to be available if you got the Pfizer vaccine for anyone over the age of 65, anyone with underlying health conditions, and also anyone who works in an occupation that may increase the risk of exposure. So healthcare workers, teachers, childcare workers, grocery store workers. I haven't even seen the full list yet. Actually, it's so new. So we are gearing up to do that. We've been planning for it for about a month now. And so unfortunately, most of our long-term care facilities that we worked with in the initial round had Moderna vaccine. So it doesn't look like we are going to be able to give them boosters yet. I know that Moderna and Johnson & Johnson are in the process of submitting their booster data to the FDA. So we should know more on that in the coming weeks and months. And then Pfizer vaccine for kids between the ages of 5 and 11 who are not currently eligible. Those data are being submitted for review to the FDA as well. And the word that we've gotten is that that should become available to people who want it sometime around the end of October, 1st of November. So I'm happy to try and answer any questions you might have.
So Maggie, yesterday in our meeting, there was the question about crossing over. If you'd had one vaccine to start with and the other, you want to make any comments on that?
Yeah, so the most recent information I have on that, Commissioner Mosier, is that that is not a doable thing at this point in time. That the only thing that's been authorized is Pfizer for people who've had Pfizer. So that may change over time, but that's the guidance we've received so far.
Okay. And then another thing that was brought up yesterday was your staffing, how you've ramped that back up.
Yeah, so in June, because we thankfully had a really significant drop in cases, almost, to the point where we just had a handful a week, we did lay off some of our limited service COVID investigators, and because we just didn't have the workload for them. So almost as soon as we did that, our cases started climbing again. And so we have brought back 6 of the 7 people that we laid off in, their last day was in like the middle of June. And we've hired some additional COVID investigators as well to supplement that. We also have hired a couple additional nurses to help with vaccination clinics and a couple of customer service reps to also help with those vaccination clinics.
And maybe cover where the vaccination clinics are and what's going on with them now, if you would, please.
Sure. So we continue to do community-based clinics. So we're providing shots down at Idaho State University. We've been to like the food truck roundup down in Old Town Pocatello. We've done ISU Welcome Back Orange and Black. We've done county fairs. We've done parks in some of our more rural communities. We were at the Eastern Idaho State Fair. Just trying to take the vaccine to where it's easy for people to access it. When we start the booster things, we no longer have the availability of the building on the ISU campus by Holtz Arena, so we are going to be running booster clinics in one of our larger spaces here in our own building. So we've been like mapping out the flow for that, and we're gonna probably, it looks like we'll be able to start taking appointments for that today. And so that's our plan right now. We will continue to do strike teams out in the community. So we've done a lot of things like agricultural operations. There have been quite a few farmers throughout our 8 counties who have asked us to come in and provide the vaccine for their workers. We've worked with Amy's Kitchen, just like a whole long list of businesses that we've gone out and provided the vaccine on site, and we will continue to do that.
And then we're headed into flu season.
We are. So we really are encouraging people to get that flu vaccine. If you haven't had your COVID vaccine and you're interested in getting it, you can receive both of them at the same time. They just need to be placed about an inch apart, or they can be given in one in each arm, either way. So we are definitely highly recommending that you get your flu shot.
The counties has a health fair going on, I think, next month. Have they contacted you at all?
They have. Right now, we are not sending teams to health fairs just because our staff are so stretched out doing vaccinations and that sort of thing. So I don't know that we will be able to do that this year.
Okay. Well, and I thought what they was going to ask you to do was come down and do the vaccinations at the health fair.
Well, it wasn't communicated directly to me, so I will have to do some checking on that.
Okay. And I'll do some checking on my end also.
Okay.
Yeah. Anybody else have questions for Maggie?
I have a quick question, Maggie. Are you seeing a large uptick in testing going on? And the reason I ask is my son went to the drive-in testing up at the building up on Alvin Ricken Drive at ISU, and the line was around the parking lot and out onto the street. And so I'm just curious if you're seeing a huge uptick in testing and what the response times are for getting results back.
Yeah, that's a great question. So we have seen a pretty significant jump in testing demand. And, it's interesting. I think it really just depends on, like, the day and the time of day, because I have 2 close family members who went separately. One, when she got there were only 3 cars in front of her, and one of them just drove right up, didn't have to wait at all. So it's really variable. And then test results, I think, are taking up like 3 to 4 days right now, which is not great. It's not the worst it's been, but again, the demand is just so high, not only locally but nationwide, that we just are going to unfortunately have to be patient with this.
Okay, thank you.
You're welcome.
And then there was conversation yesterday that you've called the National Guard, like there's 4 National Guard people up there helping now.
We did. So the company that actually conducts the testing, Express Labs, has been trying to hire people, and I mean, they're paying a decent wage. I think they were paying $15 an hour, which is more than a lot of our staff make. And they couldn't get people hired. And so we were trying to supplement with volunteers from the Medical Reserve Corps, but that is not always, like, people aren't always available. So we did put in a request for support from the Guard, and they have been wonderful. And so we're very appreciative of that.
And then there was a comment about yesterday that there was like 300 per day, basically, that's being tested up there.
Yeah, we get an update daily from the Express Lab folks. Let me pull the one from yesterday. I can tell you. So yesterday at the Pocatello drive-through, there were 204 people tested. Just for comparison's sake, they also run drive-throughs in Idaho Falls and Rexburg. Idaho Falls yesterday had 817 people go through, and Rexburg had 62. So just for comparison.
It's worth the drive to Rexburg.
Especially on a pretty fall day.
I truly have not seen the line out onto the road in about 10 days. And not that I'm not outside that much, but when I've been coming and going, I haven't seen that recently. So hopefully they have the workflow down, and since they have those guard volunteers helping, hopefully they've got it dialed in at this new site.
Maggie, this is Mayor England, and I have a quick question. Maybe you covered this, and I was zoned out and didn't hear completely. But as you talked about the boosters becoming available, how soon will that be? And the second part of that question is, how long after your last shot should you receive a booster?
That's a great question. So it has to be at least 6 months from the day you received your second dose of Pfizer,
Okay.
and then it's available immediately, essentially. So, unfortunately, we have our nursing strike teams working on Fridays, but we don't have any clinic staff in the office on Fridays. So our own organization will be starting probably on Monday. Other vaccine providers, I know I was just got off a call with hospitals around the state, and I know that, for example, Bingham Memorial was very anxious to be able to get started with this with their staff. And so I think they'll be starting today.
Okay, very good. I appreciate that. And so it's at least 6 months. Do they have a time that they'd want you not to go over? I mean, 6 to 8 months, or is it not?
They haven't said that. It just has to be a minimum of 6 months from the date you received your second dose.
Okay, very good. Thank you.
You're welcome.
Senator?
Thanks, Chairman. Maggie, first question, this is Mark.
Hi, Senator Knight.
Morning. Are you getting enough support from the state, financially or otherwise, and what do you need?
Yeah, I think we are. I mean, everyone who's involved in this response, I think, is weary of it and feeling a little bit overwhelmed. I mean, this summer we were very hopeful that we had been through the worst of it, but Delta variant kind of upended that. So, yeah, we have conversations almost daily with our partners at the Department of Health and Welfare. We're on calls daily with the hospitals from around the state. So I think that, everybody's doing the best that they can, and so I think the support is sufficient. Thank you for asking.
Well, if I can help, let me know. Another couple of questions, Mr. Chairman.
Go ahead.
I was surprised at how cavalier we have been about this, not lately, but going back. And I did some research on what our death rate from capita is per 100,000. In other words, try to make it even comparison-wise. And I'd like to read off the states that.
Hey, Senator, I'm having a hard time hearing what you're saying.
I'm sorry, Mayor. I'd like to read the states that have a lower death rate than we do in Idaho.
Can you hear him now?
Mayor? Brian?
Now we can't hear Brian. You probably need to get him just a little closer to the phone. We're just barely picking him up.
I
Come on
was
up
going
here.
to say, I could just barely hear him the second time.
Come on up here. Read that. We'll get him closer.
Thank you.
Need Kevlar up here.
Right here.
What I'm trying to do is figure out how we increase people to get the shot. We're dinking around on whether it's a mandate or whatnot. But here's what surprised me. If you compare the number of states where our death rate is higher than they are on a per capita percentage basis. Let me just go through them. Wisconsin, Virginia, Minnesota. We're higher than Colorado, Nebraska, New Hampshire. We're higher than Washington, Puerto Rico, Utah, much higher than Utah's death rate. Oregon, Maine, Alaska, Hawaii, and Vermont. And I think people would be surprised that our death rate as a percentage of our population ranks that high. And I know, Maggie, you have this information. The reason I'm pointing this out is over and over we're trying to figure out how to get the word out without, I guess you're going to put handcuffs or shackling people, encouraging them. So your thoughts would be helpful. And double check me on these numbers sometime, okay?
Yeah, so, that's, I think, important information, Senator Nye. One thing that we try to do is put the information out there and let people process it themselves. We try to present the data in a way that, because sometimes the data becomes so overwhelming that people just check out and they don't pay attention to it. So, a number like that is very important, especially for policy and decision makers. Sometimes what we've found is that when you share those kinds of things with the general public, we are accused of fear mongering, and there's a kind of a catch-22 out there with that. But I'm certainly open to suggestions related to sharing that type of data.
This is Mayor England. I have a couple of thoughts here. I've been processing this quite a bit, and I've been talking to a whole lot of people. And what I've done is gone back and looked. This isn't brand new to this world, this pandemic type thing, these kinds of challenges. They're new to those of us who are alive today. We've not experienced them. But I've gone back and done a bunch of reading on the Spanish flu and about polio, and very similar things happened. The big difference that I see as I read what was published in papers and things like that is the medical world, the medical professionals led that discussion right from the beginning, right on through. And I'm sure they had some pushback, but not like we have today. Today, the politicians got involved, and it's become so political that people believe that your political stance is what you need to do instead of doing the right thing for our health. And to me, it's absolutely a cry and shame, but I hear what Maggie's saying. I don't know what we do about this now, because we have people who position themselves so solidly that they've got to be willing to stand up and say, okay, I was wrong, I've got to do these things. And they're not willing to do that. Again, it's a political football, and it's awful. It's absolutely awful that we've allowed that to be. And how do you undo that now? And this concept of who's responsible for that, it's everybody who's a politician. I don't care what's behind your name, whether it's an R or a D or an I or a C, whatever it is. If you have made political statements about this publicly, you're part of the problem. And so I sit back and say, what do we do as politicians? Because whether we like it or not, that's what we are. We've got to be careful. We've got to allow the medical world to come in and have their say. And like I say, one of the things that's happened with that is that the medical world got involved with some of our politicians, and so now people are saying they can't trust the medical world. And I'm sitting there going, if you can't trust your doctor, you're in pretty bad shape. So that's what I keep telling people. When we get to the final decision, I say, who have you talked to about this? Talk to your personal physician. He knows you, he knows medicine, and he will instruct you to do the right thing. And that seems to be about the best thing. But I think sometimes I look at this and I think some of us who are in the public sector, we maybe need to butt out of it because people aren't going to listen to us. They think we have a position because of our politics, and it's sad.
So if I might just add to that, I think that another thing kind of hand in hand with that is as politicians, and it's offensive to me to be called a politician, but it is what it is. That being said, what do we need to do? How can we get the hospital to get out in front of this? Maggie has been running this charge for a year and a half now, and we have been in the middle of the crosshairs of that. What do we need to do, or can we, does anybody have any influence to get the hospital to step out and start talking about it? I read a story in about Canyon County this morning, and I don't hear anything about that from our hospital here, but I know that we had our meeting on Tuesday. Maggie, you could tell me we had 47 COVID patients in the hospital, admitted in the hospital, or something like that. Is there a way we could get the administration of the hospital or get them talking about it? Because their silence is deafening to me. It isn't helping our cause.
Mayor Black, I appreciate what you said just now. I've been having conversations with them on an ongoing basis, but I have very little influence with them. And I've been asking just that exact same thing because the hospital systems in other parts of the state have been very vocal about what they're experiencing. And the people that I know that are working at the hospital right now are exhausted. They are working an unbelievable amount of hours. And you know, that's the profession that these people chose, and I understand that. But this truly is unprecedented in our lifetime. And the stress and strain that they are under right now is significant, and we're seeing that in attrition in those professions. And one of the biggest problems that they're dealing with right now is they don't have the staffing resources that they need. And so if any of you have the influence to increase that voice in our community, I would be so appreciative.
Well, Maggie, I read this story this morning, and I've talked to a number of professionals that are working in the system. I talked with Dan Snell last weekend. He said that even when they try to get traveling nurses now, they can't because people are just burned out. They can't. It's heartbreaking. They've got PTSD happening right now. As I read the story this morning in the
newspaper over in Canyon County about nurses that when they leave the hospital, they go sit in their car and cry on the way home because they just can't stand it anymore, and then they get called back a few hours later because they need to be back in there, and it's heartbreaking. It's what it really truly is, and I don't know, but politicians, I agree, need to stay out of it. We because it's become a political thing. I agree with Mayor England on that 100%. But I have a hard time with our hospital not stepping up and just stating the facts of what's happening. That's very confusing in our community right now. Is people hear one thing, but then they hear another thing from other people, but the hospital is silence, and so we need to do something. I don't know if somebody else has more pull than I do, but I've been pounding on them to be more vocal in the last month and a half, and it hasn't helped. So I think that'd help our community a little bit.
Any other comments for Maggie? Thank you, Maggie.
Thank you. You all have a great day.
Appreciate you.
Take it slow. Thank you for your support. Our team appreciates that very much.
Okay, thank you.
Take care.
All right. Now, who all do we have online now? Mayor England, Mayor Bladd?
Yeah, I'm here, and I heard Mary England.
Yeah, and I heard sound like a couple more people come on, but maybe not. All right, look, Mayor England, let's go ahead and let you have some time to share with us.
Well, listen, I appreciate this. I really do. A whole lot of good things are happening. What a beautiful day we have out there today, and I think a lot of things are going to happen. Let's make sure that we all get involved with ISU's homecoming this weekend and support our university. That's got to become a bigger and bigger deal. We still have too many people in our community who are a little passive about the fact that we have a university here in town, and I just don't get that. I have a son who spent his mission in Tallahassee, Florida, and he said, you almost couldn't go outside on game day because of all the things that were going on. And I sit here and I think, we've got this beautiful university that's got all sorts of potential, and too many of us are so passive about it. And we talk about things we could do to help with economic development, to increase beautification, and all the things we need to do in our communities. And I can't think of any one thing that we could get behind that wouldn't produce a lot of what we want to see. That just recognizing that we have a great university here in town, let's be part of who they are, and let's get behind what they're doing, and let's celebrate. And so I'm just encouraging everybody to make a big deal about this weekend. Get out and celebrate. Get out and make some noise. I guess that's what I'm going to say. We're in the middle of silly season, so it's hard for me to concentrate on much of anything else. These elections are very interesting as we run them. It's the one part of the public life and being in an elected position that I dislike immensely. I suppose it's an important part of it because that's how we decide who's going to serve in what positions. But it's a difficult time. But all that being said, it's good to see people out putting their name on the ballots and getting their word out. I think again that can be an important part of what we're doing is to have a platform to speak. And hopefully truth can reign, because a lot of times our truth has to be defined, and that's an interesting process too. But I had the opportunity to attend the debate that the Bannock County Republicans sponsored last night. I had a good experience. It's good to be able to have an opportunity to have that platform, but I'm still awfully concerned that there aren't enough people that get involved. When I think about what's at stake and all the things that are going on, even though there were plenty of people there, that place should have been overrun, and it's too often it's not. I will be participating with one on the 7th of October, and my guess is because we're little Chubbuck and don't have a whole lot of issues, we probably won't have hardly anybody there. That's my guess. We're gonna make sure people know what's happening and encourage them to come. But again, let's all be part of that process. It's the process of what we call self-governance, and everybody should be concerned and involved. But I'm grateful for everything that I see going on. I just might make one other comment about our COVID challenge. I will say this about my community. I see people out here making good decisions. Again, we can't. There's no way for me to know who has decided to be vaccinated and who has not. But I get to view other things that are going on along that line, and I'm telling you, I see people making good decisions. I feel for what the school district's going through right now. I think they need to be very careful about mandating. I'll just share my thought about that. I believe that we have people in our society right now who, if they were educated appropriately and understood what was going on in our community right now, would make the choice to wear a mask. But the very minute that somebody says, you will wear a mask because I said so, they're not going to put a mask on, even though they basically know it's the right thing to do. And so I think that, again, as public officials, as much as we can, we need to get the truth out there. We need to make sure people know. We have a challenge, folks. There's no debating that. I guess the debate is how do we approach that challenge? So we need to make sure that they're educated the best they can, and then we need to be willing to let people make their own decisions and choices. And I just want to express that in my community, I've been monitoring this really close since this started to tick back up, and I see people doing the right thing. So that's what I have. Thank you so much.
All right, thank you. Mayor Blatt.
Hey, thank you very much. Thank you for the Republican Party for hosting a debate last night. Mayor England, I'll tell you, I appreciate you being there. I just looked at my calendar, and October 7 happens to be a council meeting for us, and I want to be there for you, but know that I will probably be in an argument with the 3 of my council members.
That was last night. Oh, excuse me.
Hey, man, you need to get your priorities straight now. Come on.
What I should do is just have Heidi run the meeting, and then I won't have to be in an argument with them. Anyway, a couple other things. We are in the middle of a walking challenge, and I just have to tell you, Mayor England is killing it. I think he's got a little string tied to a treadmill, and it just bounces around, and he just turns it on and goes to work and comes back and grabs his little pedometer deal, because I don't know how many steps have you got, Mayor England?
Well, let me just tell you, Brian,
Started this week.
I've had people giving me a bad time about this, and I'll admit that I picked it up this week, but you got to remember, I'm an old guy, and I used to jog. I can't do that anymore. I used to lift weights. I can't do that anymore. So all I do for exercise is walk. And I usually walk between 15 and 20,000 steps a day, and I'm getting closer to 30 now. So I'll admit that I've picked it up a bit, but it's not that unusual for me.
And I know that somebody was asking me about it. I said, hey, Mayor England, he walks. He gets up at 4 in the morning and he walks 20,000 steps before you even open your eyeballs. And so they were like, okay, so this is legit. I said, oh yeah, it's definitely legit. He's a walker, so he's going to win this challenge, I think, hands down. I still haven't been able to get my pedometer to sync up to my move spring yet, but I'm going to get some help with that. I'm sure of that. A couple other things, real quick. Idaho State University, they've got me involved in their strategic plan process. They just started it up after about 2 years of missing it, and so we're back to square one with that. So we'll see how that goes. Appreciate Mayor England talking about the homecoming parade. We got to get out and support ISU. This is what a gem we have in our community, and I'm just glad that they're there. And we do have the parade tomorrow, and we got the homecoming game tomorrow, and all kinds of activities this weekend with it. So if you haven't don't plan on doing anything tomorrow, at least come up to the homecoming game. You can go to the parade and have a good time there. In Pocatello, we also have a comprehensive plan moving forward, and I think it would be important for the county to weigh in on the comprehensive plan as well, because we've got a number of things that affect the county as the largest city in the county, and so we desperately need the county's input. I believe there's some ideas that we might be able to do, but we can't do them unless we start now. And the saying is when's the best time to plant a tree? And it was 30 years ago, because you'd have the shade today. And so if we don't start planting that tree right now, in 30 years we won't have it. And so we've talked a little bit about some sewer things that could happen and could help. Some other issues that might be out there that we can work together on as a city and a county and as a community, with some of those things. And so, as I see Pocatello growing, Chubbuck's growing, Pocatello's growing, Income's growing. Eventually, you're going to have houses from McCammon to Fort Hall if we don't plan and look ahead. Then we might find ourselves in a lot of trouble. So we probably need to start looking at some of those things that way. Then one other thing that we all need to be aware of, the school district has, as Mayor England mentioned, the school as a special meeting, I have encouraged them to rescind that mask mandate, but I don't know what they're going to do. There's a lot of, it's very ambiguous on how to implement it and what to do with it and stuff. And so I anticipate them rescinding that, but having another meeting next week. However, in the middle of this stuff, a person running for mayor out there has decided that he's going to organize an uprising and really go after the school district with the intent to be very aggressive. They're encouraging students to be very aggressive towards the students and administration and video it so that they can put it on the internet apparently and just make a whole lot of negative things happen here. So that's going to happen. I received a text. They're planning on having high school students at Highland High School on Monday meet and go in with a maskless walk-in, and with the intent to go be aggressive against the teachers and the administration. They believe their high school students have a backbone that they will go up and argue and fight with the teachers and administration. At the middle school, all middle schools, they're planning to do the same thing, meet in front of the school and then approach administration that way with parents and students. And then at Ellis Elementary School, Mary,
He's wearing his
what
Halloween
I'm
mask.
worried about for you. At Ellis Elementary School, they've called that out. They're planning on meeting at 8:05 to go in and do the same thing.
The Master Chief helmet.
And so it's something we need to be aware of. We probably need to be paying attention to and watch it fairly closely. There is supposed to be another big protest coming up this afternoon at the district office because they are having a special meeting here. If it's peaceful, everything will be great, but we might want our law enforcement to just be aware and paying attention a little bit more to that, because it's not, this isn't a great thing that they're planning right now. So,
hey Mayor, this is Commissioner Tubby. I have some insight into the high schoolers. I have some family that has to be there. And actually, I think the students have grown a spine, and it sounds like they're probably going to pull fire alarms and walk out. They're going to protest next week. It sounds like they're probably going to do it every day next week is what's going to happen. So the kids themselves, and we did it in 1998 when we needed a new high school, we decided to protest and walk out. But it sounds like the kids now themselves are pretty fed up about it. And you're going to have a whole bunch of seniors and juniors and sophomores that are just going to decide enough is enough, and we're not going back to class and we're leaving. And so we might want to just be cognizant and mindful. I appreciate youth in that age that are willing to express their political beliefs in a peaceful manner, and we should probably make sure that they're not unduly intimidated by people if they do decide to do that, because that's one of those things that, you know, they'll figure it out. And the last thing that we want to do is piss off a bunch of high school kids and let's see if they can find something to burn. So.
Well, and Commissioner, I agree. If it's the students, then it's one thing. What
Yep.
I'm concerned with is the parents. So
Oh,
let me
totally.
just
Yes. Yes.
read you and honestly, students haven't had an issue with this stuff. It's all been generated by parents in the past. But let's see what it is. I received this text last night, shared with me by a concerned friend. You have probably already seen, but just passing along information. So I wanted to give everyone, this is the text. So I wanted to give everyone who wasn't available to be in the meeting last night at a synopsis of what took place and the plan we have come up with. As a group and as parents, to hopefully keep our kids healthy and safe the way we choose, not the way the district, quote, mandates, unquote, and also keep everyone's rights equal regardless your stance on this subject. There were a few options presented, and as of now, we have decided that on Monday, September 27th, we will be doing a, quote, maskless walk-in, unquote. High school students, we would like them to get videos of teachers or administration being aggressive towards them on this matter if possible. There is a group of parents that are going to meet at Highland. I'm not sure of where it will be at, but we will also know that our high school students have much stronger backbones than the younger kids, and for the most part can stand up for themselves. For our middle schoolers, there is a group that is meeting, I believe, at each school. I know for sure at Alameda, it will be at 8:30 at the bench in front of the school, so we can approach the administration as a large group of parents and students, letting the administration know they are not allowed to put medical devices on our children! Exclamation point. Ellis kids will be meeting at 8:05 in front of the school, also to approach as a large group. Then at 2:30 there will be a protest in front of the school district on pole line. We would like as many to be there as possible. This has to be done in large groups to show the school district we won't back down. We also need the word to spread, so please share this with everyone you know. So, Commissioner Tubby, I agree with you. If the students are doing this, then we let the students express themselves what they need to do, and the school district can handle that. If we have parents that are encouraging the students to be aggressive to the point of for them to be able to show aggression on the other way, then we're in trouble.
Yep.
And so that's my concern. So I just think we need to be prepared for anything. It could be nothing and it could be something. But I have encouraged the school district to rescind the mask mandate, to encourage people, because what this is going to do, in my mind, is within a week and a half, 2 weeks, we will not be going to school, we'll be online again. That's my concern.
Yep.
And so we just need to be prepared for anything that could happen. I know that they're working with Pocatello Police Department right now, and the school district is. We plan on being there just in case something gets out of hand. We're not planning on doing anything other than sitting back and letting the protests happen unless they become very aggressive and there's a law being broken. That's where we are with this now. But we'll see what happens. They did. What's his name? David Worley did call the chief of police yesterday with threats about protests and about what they're going to do. And we've had a number of officers called by parents that have said, you need to choose what side you're on. We're not choosing a side. We're staying on the side of the law. And if you protest peacefully, you're great. If you protest with violence, you're not so great. So that's kind of where we're standing.
Well, this is Mayor England. I realize they've got the weekend to readjust, but they're going to look pretty foolish if they rescind that mask mandate with the idea that they'll revisit it next week if they try to do something on Monday if there's not a mandate in place. So I don't know, maybe they'll regather and readjust if it gets canceled.
Well, my hope is they will rescind the mask mandate, and that in rescinding the mask mandate, they will actually have some talks about, okay, what are we going to do? And I would hope that they would include us, community leaders, in some of those discussions, so that at least we can be prepared for what we need to do here. Good point.
Okay, anything else, Mayor Bladd?
You know, that's it. I don't want to be an alarmist, but I just want us to be prepared, and just thank you for this meeting. I think this is a great meeting, and I don't know if anybody else got on.
Well, Mayor Schaefer's right here in chambers with us, and so is Senator Nye.
It's good to have you there. It's great to be able to coordinate some things. So thank you.
We'll give him a turn here.
Thank you. And it's nice to be in chambers here today and to listen to the things that the other two mayors have said. I guess my first comment is, I don't count my steps, but they're not very many. And then the highlight of my thing this morning is I wanted to highlight that our Revitalization Commission in Eakin was having a Harvest Fest Saturday at the ski area, but I almost feel ashamed that we might miss part of the homecoming festivities if we go to that. We're grateful for the community in Eakin and the things that go on there and the things that don't go on there. As far as COVID, I walked in on a heated debate yesterday morning in one of the establishments in Eakin, and they said, "How about it, Max? What have you done?" And I have taken a picture of my CDC card for my annexation, for my vaccinations, and I also donated blood, and they sent me a thing back saying that I had the antibodies for COVID when I donated blood. So it was real easy to show them a picture that I had antibodies, I had got both of my vaccinations, and I lived through all of it. And it took away a lot of that. Well, I heard if you do this that you might have 6 fingers on your other hand by tomorrow, or all the fear mongering and public shaming that goes on with that. I can go back to the very first time we held this meeting. The comment was made several times: educate the people and let them make their best decision themselves. And I go back to that to this day. We don't need to be publicly shaming or fear mongering or trying to pressure anybody into our decision. We need to give them the best education we can and let them make their best decision. And I will stand by that forever. The other thing I guess I would share is that we're ongoing with the negotiations for annexation of the Portneuf Meadows subdivision. It's been approved to move forward through the county, but we're still negotiating with the developers to try and get that annexed into the city. We have one final proposal from the developers we're going to address next week in a special council meeting, and then see which way that goes. So
Which one is that, Max?
Portneuf Meadows, the Gilbert property.
Oh, the Gilbert property. Okay.
So other than that, thank you all. I appreciate hearing from the other mayors and being here in the council chambers. Thank you.
Max, this is Mayor England, and I had somebody tell me the other day, sure, you got the vaccine 6 months ago and you're fine now, but within the next couple of years, you're going to grow a horn out of your forehead.
Sure, and that's.
I personally think that'd be kind of cool.
Well, we already knew which direction you was going anyway.
That's exactly the debate that I walked in on yesterday, Mayor, and it just kind of calmed everybody down to say, I'm not guessing. I had the virus. I got over it. It wasn't very fun. I was sicker than I thought I would be, but I got through that, and I have the antibodies. Even knowing that, I still chose by the education that I gave myself to go get the vaccines, and so far I haven't tipped over. So
good for you.
I would still just give the people the best information you can and let them choose for themselves.
That's right.
Senator Nye?
I've got some good news.
Okay.
I don't know if you all have got, this is on our state budget. I'd like to circulate the latest that just came out. It's, our fiscal year started July 1, so this is through the end of August. And maybe we can get everybody a copy if you like, if they want.
Okay.
This shows that we expected at the end of the session to have 77 million for a carryover. The update is we've got $1,400,000,000 carryover. So the difference is an extra $1.3 billion. That's not counting the COVID money that's coming in. The major source of these extra funds is from sales tax and income tax. But anyway, this is a 2-page document. It's pretty easy to read. And
Okay.
Want to get me and get it out there, buddy?
okay, thank you.
Thanks, Senator.
That's all I got. Thanks.
Mayors, did you hear that?
I heard $1 billion. I heard
1.4 billion, but I didn't hear anything after that because my head kind of exploded.
That's the carryover that they've started with in this year's budget.
It's gonna be hard.
So, Senator, how much are you going to give cities and counties of that 1.4 billion? And we'll take it.
He's got a big smile on his face.
That is up to you. That is up to you, isn't it, Mark?
Oh, well, Bannock County gets it all, right?
Oh, you heard it.
It's on the record, Nancy's got it.
If you start a casino, you know.
Oh, we're gonna compete with the Fort Hall.
Yeah, that's right. No, I'll tell you, that is great news, that we've got that much excess. So that should help everybody, I would think.
Yeah, it hurts, everybody's expectations are gonna be so much higher. They all come in for more, you know, so we'll try to get her done right.
Thank you.
Senator, did you want this copy back when I'm done?
No.
Okay.
Wes, do you have anything for this group?
Yes, we just submitted the hazard mitigation plan to the state of Idaho. So they're reviewing the document. As soon as they give us comments and feedback on that, then we'll be able to submit it to the Federal Emergency Management Agency for approval. We finished up on the review of the emergency operations plan. We'll be doing some technical writing and making sure that's a clean, legible product, and we're moving forward on that. We started the putting together the mobile communications EOC, which is a RV that was donated to the sheriff's office, but we found a better use for it, so we have that capability to have communication components and interoperability, and so we can deploy throughout all areas within Bannock County as well as southeast Idaho, and even further if need be, because it'll be a type 2 trailer or a vehicle that can be responding to FEMA requests. So we've got a lot of good things going on within the county. We've got a lot of support from the first responders and the community at large, and I think it's looking up for a lot of the involvement and activities. We're still looking at going with a regional emergency operations center, which is going to be more cost effective and minimize the impact on the resources, so that we have longevity and resources that can actually provide competent and capable response capabilities for a long duration. And everybody's aware of the taxing of the work and the tasks and everything associated with COVID, but if we had a regional EOC, that's going to minimize that impact and reduce a lot of the funding within this area. So we got a lot of good things we're working on, and definitely going in the right direction.
Okay.
Hey, Commissioner, you just made me remember something that I wanted to tell this group.
Okay.
City of Pocatello just approved, working with the Underground Railroad, a mobile command post or a mobile EOC within our police department, and so that we have that capability. As soon as we get that trailer here or that unit here, we'll have a big opening of it and stuff. But that's something that the county can probably put in as an asset that is available if we need to have an EOC command post in South County or somewhere like that. It'll be nice to be able to have those resources. It's 100% functional. As soon as you drop it off and turn it on, it goes. And so that's something to keep in mind.
Thank you. Any other questions or comments for Wes?
Fire season we've survived so far.
Yep, we're doing very well on the fire season. We're still continuing to watch her and stay apprised of what's going on, because we're still not out of the woods yet.
Yeah.
No pun intended.
Well, last week, Commissioner Huff and I went down to McCammon. They had the ambulance volunteers from the south end of the county all had a banquet and stuff. It was pretty impressive. We have a lot of good people that volunteer a lot of time, and Mayor Blad, we appreciate the communication and the direction from the fire department here in Pocatello. they have a great communication, great working relationship. Also along that line, we just okayed for 60 radios that will be used by those individuals. That was about $120,000 that we just spent on that. And so we're trying to bring everybody up to snuff a little bit and give them the equipment to do their jobs also. Jason, anything for this group?
Coming right up, everyone should know we have pretty big elections coming up across the county. So October 12th, early walk-in voting starts. And then I just want to say thank you to both mayors on the line for your police chiefs being so willing to help with the security that School District 25 has asked for. They always respond really quickly and are always willing to help. So I just appreciate that. That's it, really.
Okay. Commissioner Tubby?
As far as county business goes, we okayed task order 1 with CDM Smith for remediation and cleanup at the landfill this last week. Is about what was it, 1.5 million total effort to continue in remediation efforts. In the last 6 years, we've approached just north of $10 million in remediation and cleanup. They've done a lot of geosensing and actually understand now how and why and where everything's going, and now they're actually starting to punch in wells. They're probably going to do some fracking wells to break some of the stuff and be able to move and dislodge some of that contaminant that they can start actually processing and working through that. But that's something that everybody in the county needs to know, is that we do take environmental cleanliness very serious, and we have spent a lot of money to remediate that problem, and it's not going to go away anytime soon, but it is something that we have kept at the top of the priority.
What is the life of our landfill, Darryl?
Right now, this next cell will bring us up probably another 20-25 years of airspace. The big thing is how fast the county grows will determine how many more lifts and cells. We have capacity at our landfill for over 100 years in plans and land that we can go and do. But we do need to be mindful in remediation and cleanup and what we do that way. So,
Commissioner Huff?
No, everything I have has been talked about, so.
Well, I used to have a couple of things. One is we have the LDS temple that is in our area that is doing an open house right now. And the numbers I heard from last Saturday was about 18,000 people went through that facility. I had the opportunity to be in the Tyhee building, and there was people that come from Oregon. They'd driven all day or all night to come and go through there, and then was driving back to Oregon. And then there was a lot of people from Utah that had come up and went through that building. So it's an exciting time up there. Also up at our event center, at the amphitheater, we've had 10 concerts this year. It's been a positive growth and experience up there. Talking with the promoter that we're using, who is out of Boise, we're looking at trying to have at least 20 concerts.
They gave us the dates on Wednesday, and yeah, 20 concerts. And it'll be a mixture of country, rock, and some Hispanic to try to reach a little different audience there. So be a good rotation mixture this year.
some Latin.
Some Latin.
So, you know, it has been a tough time with COVID, but it seems like everybody's checkbook has grown a little bit. I don't know. In the state, like I say, I was at the health board meetings yesterday. Their budget is increased, and they have quite a bit of carryover. So, yeah, there's negative things that have gone on, and we've lost some people, and that's a tragic. But also, I appreciate people have stepped up. They really have, and you know, we live in a wonderful place. I just encourage anybody this week to drive over the top through Buckskin and around to Inkham and look at the trees. They are beautiful. And what a time of year and what a place we have to live in. So thank you all for your service. Thank you all for participating on these calls. And if there's nothing else, we'll
Move on to our next meeting.
end this meeting.
Thank you much. Goodbye.
Thank you. Goodbye.